Hi, this is Dr. Scott Hoar, and today is Treatment Tuesday. So this week we'll be with Sue Mihawk. Sue is a retired school teacher, and Sue, you've been dealing with some things, so let us know about it.
Yeah, well, I searched you out when I was having severe knee problems. That was 4 years ago.
4 years ago you've been with us, right?
And I'm still here, but not because of my knees.
Yeah.
My knees actually are so much better now. They're like 100% unless I abuse them, and occasionally I do. But all of a sudden, in bike riding and things, my right hip started to act up.
Sure.
And it got to the point where I was actually using hiking poles because I could not put all that weight on my hip. And I was seeing you at the same time, and you gave me a new set of exercises, and I'm still working on my hip. I found out that, there is a little osteoarthritis there, but if I ride my bike or if I'm just walking, all of a sudden I'll feel a pain. So it comes and goes. Now it's getting better.
Why is it that you're still coming to see me? Because some people would see that as, you see me 4 years later, you haven't fixed anything.
Oh, no. Well, look, my knees were fixed, but still there comes a time when they get stiffened because of my age, 72, and you say, I think we need to loosen this up here,
Sure.
And so I consider seeing you as the type of maintenance program, really, for my body.
I'm glad you feel that way. And we're going to do a treatment on Sue today. And one of the things we're looking to show is maybe some of the gentler techniques that we use that are more appropriate for somebody like Sue versus some other patients that we've dealt with in the past. So take a look. Sue is an existing patient, and in the past we've done full medical history, full examination. We've taken x-rays that showed a little bit of that arthritis in her hip. And I'm pretty familiar with how her body works, so we're going to go right into the treatment phase for today.
Okay.
One of the main things we really want to focus on with Sue, given that the right hip arthritis is really the main complaint, what we want to do is really get the hip moving as much as possible and minimize the other parts of her body that aren't moving so well that would lead to extra stress on her hip.
That's the fascinating part.
Well, what do they say? The hip bone's connected to the knee bone.
There you go.
Sort of
Exactly.
I am the daughter of a doctor, a surgeon, so chiropractic practice was always, a no-no.
That was a no-no.
No.
Okay.
And I had a tough time telling my dad that I was going, actually, even at my age. But I said, Dad, it's remarkable how far I've come. And, I listened to the advice. I went to the strength training, and I'm stronger, and I'm a lot happier. And I'm an athletic person. I love to be active. And I cried to think that, this osteoarthritis was going to keep me from doing things I love to do. But you have helped me to live with this and to have a better body.
Very good.
Ah, nice.
All right, so I'm going to do some muscle tests. Some of these might be a little different than what we typically do.
Okay.
Make a fist for me. I'm going to push your elbow down to the table. Don't let me go.
Okay.
Lovely. Okay. Put your thumb and your pinky together like that. I'm going to pull them apart. Don't let me do that. Ready? Go.
Yeah. Ah.
Not so good.
No.
All right. So this is an activator, and I'm going to use this to adjust the segment that we want to adjust without doing manually, because some people don't like the manual adjustments to their neck. So the muscle test that was just weak was the thumb-pinky one.
Yes.
And the nerves that come out of right here are mainly in control of that movement. So I want you to turn your head to the left.
Okay.
And I'm going to put it right here.
Okay.
And give you a little of that.
Wow.
Okay.
All right.
Back to neutral. Thumb and pinky together.
Okay.
Pulling apart. Don't let me.
Okay.
Much stronger, huh?
Nice. Yes, I like it.
Very good. All right. What I'm going to do now is pull your elbow over here. Don't
Okay.
let me. Go.
All right.
Lovely. Very good.
Okay.
Let's go check the other side.
All right. No matter how many times I have a weakness and you do something to my vertebra, and then it works. It is just, it's fascinating. I can't get over it.
Yeah. Well, it's always amazing to find something dysfunctional
Yeah.
and then make it functional right away.
I know.
And that's really the miracle of chiropractic in my mind.
Ah.
Make a fist, pushing down. Don't let me. Go. Lovely.
Okay.
Thumb and pinky pulling apart. Don't let me. Ready, go. Awesome. I want you to put your fingers together behind your head.
All right.
And your elbows together.
Okay.
Good. All right. So I'm just rocking you back and forth.
Mm-hmm.
We've done this before. And we're looking to really maximize thoracic spine, that's your upper back movement, without having to really yank and pop on stuff.
Mm-hmm.
A little stiff there, though, isn't it?
Yeah, I feel
Okay.
it.
Put your hands right here.
Mm-hmm.
I'm going to twist you around. So spread your feet out a little bit just so you have a little bit more balance.
Okay.
Good. And I'm just going to rotate you
Okay.
back and forth. And we got to get that spine moving, huh?
Yeah.
Okay.
Yes, I feel it. Oh, wow. I wish I could do this for myself. It feels good.
Don't we all?
Uh-huh.
Nice one.
Okay.
Mm-hmm.
Wow.
A release there, huh?
Ah, great.
Good?
Yes.
Okay. All right, so I'm just checking your ranges of motion. We'll do that on this side, and obviously this side, we're expecting it to be a little bit more limited, and it is.
Yes.
So Sue, since it's limited in external rotation, which is this range of motion, what I'm going to do is I'm going to use the drops on this table to be able to actually manipulate and adjust the head of your femur without putting too much stress on it. And because there's these drops underneath the table, when I thrust into your hip, whatever excessive force that goes through your hip is created, it's going to get absorbed by the drop in this table. So it will make it a little bit less jarring for you.
All right.
So what I'm going to do is put you into external rotation, which is your limited motion as much as
Right.
possible, and then I'm going to thrust down, okay?
Okay.
Good.
Wow, again? Okay.
It's a little bit more,
All right.
but we want more. So let it go, drop. Breathe
Okay.
out. Let it go.
Let what go?
Your leg.
I can't. Oh, Jesus. Ah. Whoa.
There we go. Are you all right?
Yes, I am. Thank you.
Good. I'm going to do something similar, but it's in a different range, okay? So,
Okay.
so I'm going to lift up and I'm going to thrust down. Ready? Let it go. Good.
I have a hard time letting go, don't I?
You and me both. All right, I'm going to do a muscle test. I'm going to push down like that.
Okay.
Don't let me. Go.
All right.
And
Whoa.
again,
Wow.
a little weak over there, huh?
Yeah.
I'm going to push down that way. Don't let me go. Much stronger, huh?
On the bad hip side, yeah.
Yeah, interesting, huh? So this was your hamstring on your left side, and majority of the innervation comes out of your L5 segment.
Okay.
What we're going to do is use this Pro Adjuster, which is an instrument, and I'm going to adjust that L5 segment.
Okay.
Good. And now let's recheck.
Okay.
I'm pushing that way. Don't let me. Ready? Go. Much stronger, yes?
Yes.
Very good. Now I want you to raise your knee up. Hold it up there like that. I'm going to push down. Don't let me. Very good.
Uh-huh.
Raise your knee up.
Okay. Wait, sorry.
Cramping?
Just a little joint. Okay. That's
Good.
good. Thank you.
Raise your knee up. Pushing down. Don't let me. And that's weak.
Ugh.
So we'll grab the Pro Adjuster again.
Okay.
And we'll get a little bit more of your sacrum. Which the nerves from your sacrum are going to impact these glutes that just tested weak.
Okay. Because the nerves were stiff? Or what?
Well, they were just dysfunctional. I'll call
Oh,
them.
okay.
Raise your knee up.
Uh-huh.
Hold it right there. Pushing down. Much stronger, yes?
Yes.
Very good. So, Sue, what we're going to do is I'm going to grab your hip flexors right here. When I say so, I want you to straighten your leg and bring it back to me as far as you can, and then back to the starting position.
Okay.
We're going to loosen up those tight muscles around your hips. Okay. You ready? Go. Good. Okay. And again, go. Good. A little bit of tension in there, huh?
Feels good, though.
Yeah. And again. And again, last one. Good, okay. And now I'm going to grab the back of your hip.
Okay.
I want you to kind of lock out your leg, kick forward and towards the floor diagonally.
All right.
As far as you can, okay?
Okay.
Ready, go. Good. And again.
Okay.
Good, and again. Got some tight stuff back here in these glutes, huh?
Yes.
And again.
That's really tight.
And again.
But it's feeling great.
But do you feel that shift? That shift click thing?
Yeah, yeah.
That's the instability that we were talking about.
Huh.
That's inappropriate motion, and that's what we're going to try to stabilize during your progressive rehabilitation.
Okay, okay.
Okay, why don't we sit you up?
Okay.
Ready, go. Okay, good. And again. Good. Go.
This one's going further.
Yeah. And again. Well, that's not surprising. The left hip is the arthritic one, right? Ready, go.
No, the right.
Oh, that's what I meant. The right one is the arthritic.
Yeah.
Good. Okay. Kick forward and towards the floor. With your leg.
Oh, I'm sorry.
Good. And again.
You ready?
Good.
Okay.
And again. Yeah, much better motion over here.
Yeah. Oh.
Okay, last one. Good. Okay.
Isn't it curious that the two hips are in the same body?
Uh-huh.
So why did the right one decide to act up, not both of them at the same time? You know?
Well, the bodies are not symmetrical, though. Right?
That's true.
Your left foot, your left ankle, your left toe, your right shoulder's bothering you, which makes you put more stress on your left hip, and so on and so forth. You see that all the time. There's always compensation, and there's old injuries where you had trauma to this side, not to this side, and then your body's motor programming, or your muscle memory, has to alter as a result of that. So we're never going to be perfect, but the idea is to stabilize and minimize whatever dysfunction as much as possible. So that's why we're going to go do that with progressive rehabilitation right now.
Look, better
Slower pause, yeah.
Pause.
It's tough, huh?
Isn't it funny? I don't have as much balance on this leg.
So then what we are going to do is you hold this. Good. You feel good?
Yes.
All right, go for it.
Okay.
What has made the difference in getting the hip, which has arthritis, and it's not like the arthritis went away,
Right.
right? Arthritis does not go away. So what has had it actually feel better?
I believe it's truly what's the movement that's done here in the office, and being a good student and doing the exercises that you've given me,
Sure.
and I do them on a daily basis. And
Good.
I think those two combined have done it.
Right, yeah. one of the things we're always trying to do with you is provide strength and stability to your hips, to your core, to your pelvis. And so what we've really been working hard on is really giving you that balance, control, strength. And I think that's one of the things that has impacted you, because you've been such a great patient and you've been so proactive on your own time.
Yes.
Sue has started working out at the gym. She hired a trainer, and she's really gotten a lot stronger in the last number of years.
Oh, wow, I am working.
Yeah.
Those glutes, what are they?
Yep. Last one here. Perfect.
Okay.
Loved it. You did
That was
really great with
good.
that. Good.
In May 9th, I will be 72. Since I've been lifting weights, I have felt healthier, I have felt stronger, I've even felt like I have bigger lung capacity.
Really?
I really do. I was flexible before, for instance, you know, with maneuvering my bike around, but now I can pick it up and hang it on a hook, which is wonderful.
Yeah.
I mean, I can stand up and sit down, you know, without having to push myself up, and I will not quit. It'll be strength training until the end.
Yeah, sure. Good. Yeah. Remember, land on the heel. Well, I love hearing all those things you had to say. I'm very happy that we've positively influenced your life, and that you continue to experience a higher quality of your own life, of your own activity, of your own self going forward, because that's our mission, that's our goal.
I expect to be doing this for the rest of my life, and hopefully if I keep coming, you know, to see you, I can keep this up.
Well, you definitely can keep it up.
Okay. When I'm 82, 92, still be here.
There you go. All right.